Northwest Regional Primary Care Association, promoting healthy communities in the Northwest by developing the workforce of mission-driven safety net health centers in Alaska, Idaho, Oregon, and Washington.
From the very beginning, this whole enterprise has been a mission. This whole enterprise started with a vision that everyone in this society deserves and needs dignified, decent, affordable, real access to health care.
Our mission is very simple. It's to take care of people with comprehensive primary care services regardless of their ability to pay for it.
We are what they call a safety net. Under us, there is just emptiness, and this is where we actually support those people who may not have a care anywhere else.
In the course of applying through medical school, I actually discovered CHCs. I didn't know anything about them before, and I kind of fell in love with the CHC model, and that's what I wanted to do.
Community health centers offer innovative practices for our changing environment, including diverse patient populations, a mission-driven environment, team-based model of care, loan repayment programs, work-life balance, technology, including electronic medical records, and leadership and precepting opportunities.
Most of them come for another reason. It's a place to start, it's a place to grow, it's a place to learn, and then all of a sudden they're swept up in the mission.
First of all, it's probably the most rewarding career choice they could make.
We know we are competitive. We know that you will have a good experience. You will, in fact, in many respects, be on the cutting edge of primary care and a part of something that is in the center of where our nation needs to move healthcare forward.
This is a time when somebody who really takes what they wrote on their application to medical school seriously, and usually what that is I want to help people be more healthy and communities be more vibrant. You have an invitation to do that. And not only that, I think that the community health centers, where the needs are so clear, are the places where most of the innovation is probably going to occur.
We've got excellent incentives with loan repayment programs and the team-based care that we're moving towards with patient-centered medical home and people being able to work at the top of their license and really have an evidence-based approach to treating the whole patient. I think from any clinician or future clinician's viewpoint has to be exciting to think that's the kind of delivery of care that you could provide. And so I think check it out, come do a clinical placement, come take a look and become part of this movement that I think will both satisfy your career goal as well as satisfy that social pulling, if you will.
Your mission is to serve those that need a leg up, those vulnerable populations that don't get the care that they need, come to a place where you can provide it. And at the same time, you're going to innovate on the cutting edge that's going to be interesting to you. You're going to have research, you're going to have styles of delivering care that the rest of the system is going to go towards. And so for those two reasons, if that excites you, then come to a community health center and begin to experience it.
We're at a moment in time right now where we really can change the trajectory of healthcare in this country.
Give me 5. Nice. All right.
Practice where it's nearly perfect. To learn more about clinical and administrative positions at our community health centers in Alaska, Oregon, Idaho, and Washington, go to nwrpca.org and click Workforce.